Welcome back to Home Health Management Solutions, where we break down Medicare rules, compliance updates, and home health operations in a way that's clear, simple, and practical. On November 28, 2025, the Centers for Medicare and Medicaid Services, CMS, issued the 2026 final rule for the Home Health Prospective Payment System, and it brings a bunch of updates that could impact your agency's bottom line, documentation, staffing, and care delivery. In today's video, we break down exactly what's changing and what you need to know to stay compliant, protect revenue, and continue delivering quality care in 2026. So, what is this final rule? Every year, CMS updates how Medicare pays home health agencies, what documentation they expect, which quality measures matter, and how agencies are evaluated. The CY 2026 final rule outlines everything from payment rates, PDGM changes, quality reporting, value-based purchasing, and even durable medical equipment, prosthetics, orthotics, and supplies oversight. Everything in this rule affects how you operate, how you bill, how you document, and ultimately, how much you get paid. First, let's talk numbers. CMS finalized a 2.4% payment update, adding roughly $405 million into home health for 2026. But several downward adjustments wipe out most of that increase. A negative 0.9% permanent adjustment, a negative 2.7% temporary adjustment, and a negative 0.1% outlier adjustment. When everything is added together, CMS estimates an overall negative 1.3% cut in home health payments. That's about $220 million less compared to 2025. For agencies, this may mean a slightly less pay per 30-day period, depending on case mix and utilization. So yes, while CMS increased the base rate, the net effect is still a decrease. This reduction translates to tighter margins. Efficiency and accuracy in documentation are no longer optional. They are essential for survival. Next, PDGM is being recalibrated again. CMS updated case mix weights to better reflect the current patient population and utilization patterns. They also revised LUPA thresholds, functional impairment scoring, and comorbidity adjustments. So what does that mean for agencies? Your OASIS accuracy matters more than ever. This is the year to tighten up your documentation training. 1. Documentation is paramount. The weights are shifting. You must capture every specific diagnosis and functional impairment accurately in the OASIS and clinical notes. Vague coding will cost your agency. 2. LUPA thresholds are moving. The minimum visit counts required to get full payment are changing. You need to be more strategic in planning visits to avoid falling into the lower-paying LUPA category. 3. Focus on complexity. Ensure documentation clearly justifies the medical necessity and complexity of the patient's care needs. Under the Home Health Quality Reporting Program, HHQRP, CMS is removing several measures and data elements, including a COVID-19 vaccine measure and its data element, along with 4 social determinants of health data elements. A revised HHCAP survey will start in April 2026, and updates were made to the reconsideration policy and all-payer OASIS data submission requirements. HHCAP's Home Health Consumer Assessment of Healthcare Providers and Systems is a standardized survey that measures the experiences of patients receiving care from Medicare-certified home health agencies. For the expanded home health value-based purchasing HHVBP model, they are removing 3 survey-based measures and adding 4 new measures, including 1 claims-based measure, MSPB-PAC, which stands for Medicare Spending Per Beneficiary Post-Acute Care. 3 functional OASIS measures: improvement in bathing, improvement in upper body dressing, improvement in lower body dressing. Measure weighting for larger home health agencies has been adjusted, and a new measure removal factor was added. This section is huge and goes into effect starting April 2026. CMS is also shifting weight away from patient surveys and more toward OASIS outcomes and claims data. Meaning, your functional assessments must be tight, accurate, and consistent because they directly influence payment scores under Home Health Value-Based Purchasing HHVBP. This means 1. Outcomes matter more. Your performance metrics directly influence future payment adjustments. 2. Focus on quality metrics. Every interaction counts toward quality scores. Ensure interventions are effective and outcomes are positive. Consistency in care improves both patient lives and your bottom line. 3. Be specific with coding. Avoid unspecified ICD-10 codes. If the documentation supports a specific diagnosis, e.g. chronic systolic heart failure, instead of heart failure unspecified, use it. 4. Audit your face-to-face documentation. Before finalizing a chart for billing, confirm the face-to-face note is present, signed by the physician, allowed practitioner, and clearly justifies the why for home health services. And finally, ensure OASIS accuracy. The OASIS assessment needs to be consistent with all other clinical documentation. Discrepancies will lead to denials. CMS is adding 3 functional improvement measures: bathing, upper body dressing, lower body dressing, derived directly from the OASIS. This is the most critical link. The OASIS scores collected at the start of care or resumption of care, and again at discharge, now function as performance metrics. Inaccurate initial assessments, e.g., scoring a patient as fully independent when they are not, will make it impossible to show improvement, negatively impacting your HHVBP scores and payment adjustments. Consistency and accuracy on the OASIS are now performance outcomes. The emphasis is clear. Clinical data, OASIS outcomes and claims data now holds more sway than patient satisfaction feedback for calculating HHVBP performance. You must trust your clinical documentation to tell the story of the quality and improvement you deliver. Next, on face-to-face encounters, CMS is expanding who can perform the required face-to-face encounters, now allowing various practitioners to conduct them regardless of whether they are the certifying practitioner. This means improved efficiency. This flexibility helps streamline the certification process and reduce delays in starting care. Compliance remains key. The documentation within that face-to-face note still needs to clearly support the patient's homebound status and the necessity of skilled services. A valid face-to-face is mandatory for billing. On the durable medical equipment, prosthetics, orthotics, and supplies side, CMS is strengthening oversight. This includes more frequent reaccreditation, additional grounds for revoking enrollment, retroactive revocations for non-compliance, and stricter supplier monitoring. If your agency orders or coordinates DME, make sure your suppliers are compliant and accredited. So what does all of this mean for agencies? Number 1, financial pressure. Even with the update, there's a net payment reduction. Number 2, OASIS accuracy and documentation training need to level up. Number 3, functional outcomes matter more than ever, especially bathing and dressing. Number 4, QAPI workflows must be aligned with updated measures. And number 5, agencies should review DME relationships and provider enrollment documentation to avoid penalties or revocations. Here's what you should do now. Run your 2026 financial projections, audit your OASIS, documentation and comorbidity coding, update clinician training for PDGM recalibrations, verify all DME suppliers are accredited, adjust your QAPI and performance tracking tools. And finally, update your internal policies and procedures for 2026 requirements. I hope this breakdown makes the 2026 final rule clearer and easier to digest. If you found this video helpful, give it a thumbs up. It really helps others find it too. Don't forget to subscribe so you don't miss out on more tips and resources. Looking for easy-to-use digital tools for managing home health? Check out my Etsy shop. Link is in the description. If you have questions, ideas, or want to share your experience, leave a comment. I'd love to hear from you. And feel free to share this with anyone who might find it useful. See you in the next video.